Now we are joined by Net Health. Welcome.
How you doing?
Good. Okay, so kind of along with our holidays themes, New Year's is coming up, which means, you know, there's going to be a lot of people at the gym, a lot of people starting fad diets and stuff like that. What are some good New Year's resolutions?
So our big push right now is to think about what your New Year's resolution is going to be. Don't wait until New Year's Eve, New Year's Day. Go ahead and start to develop a plan now. But then you also want to be more specific. So I'm going to do a little demonstration, which is why I have my hands behind so y'all can see what I was going to do. But being healthier, going to the gym, whatever your resolution may be, those are fairly broad terms. You want to get a little more specific.
That way you don't fail.
So let's say, for example, if you want to run a 5K, you want to think about how many days per week you may want to walk and then build up to jogging. So you don't have to feel like you have to start running a 5K tomorrow. So slow and steady progress. Another New Year's resolution is for people that smoke, that use tobacco products. So our big push is not just tobacco, but it's on nicotine, because nicotine is that chemical that addicts a person to use a tobacco product.
So same thing with those Juuls and vapes.
So if it's a Juul, if it's an e-cigarette, if it's a regular cigarette, we love people. We just don't love the secondhand smoke. We don't love the tobacco. We don't love the negative effects that they have, the smell that they have. So another component of this is that you don't really get to see how nicotine affects your body because it affects your organs on the inside. So I'm going to do a little science for everybody here.
I love this.
You can't smell this through the TV, but Cynthia probably can. So this is a healthy lung. I'm going to hook up on here. So if you're a non-tobacco user, your lungs inflate like this, the way they're supposed to. You see both sides fully inflate.
Looking good.
It's nice and healthy.
As good as lungs can look.
So these are lungs from pigs. These aren't from actual humans.
Okay.
So just, I'm going to go and say that first. But then our prevention message is not just for people that are a nicotine user, but if you are not a smoker and there's somebody that you care about, somebody that you love, somebody that you work with, somebody that you live with, if they're not as aware of what breathing in nicotine does to their body, please have them look at this example. So this is a diseased lung. And if you could remember that healthy lung, you see the difference. Both sides are not fully inflating. One's a little bit smaller than the other. And then you can just tell from the color, this is a lung that's not getting enough oxygen. So when people aren't able to do physical activities, if they have to be on an oxygen tank, if they have COPD, emphysema, all those issues that relate to the years and years of using tobacco products, this is what you don't really get to see. You kind of get to hear, and you get to hear about the person's experience. But then also, we provide quitting classes, cessation classes for those that want that assistance to become tobacco-free.
All right. Well, thank you so much for stopping by on this Friday morning.
All right. Thank you.
Thank you.